Hi, thank you so much for taking the time to speak with me today. I'm doing a chemistry and careers assignment for my class, and I chose to interview a pediatrician because I am interested in how chemistry and other branches of science could be used in the medical field. Before we begin, could you briefly introduce yourself and what your role in the medical field is?
My name is Alfredo Garcia. I'm a pediatrician in private practice in Fresno, California. I have two offices, one in Fresno, one in Madera, and I see patients in St. Agnes Medical Center and in Clovis Community Hospital here in town.
Okay, thank you. First off, we are going to start with a few general questions. So, to start off, what initially inspired you to pursue a career in medicine, and how did you decide on pediatrics specifically?
I always like to interact with people. I never like to be in one place taking care of paperwork. And taking care of the health of people combines social work, science knowledge, chemistry knowledge, and that's why I chose medicine. In my point of view, pediatrics is the most important medical specialty for two main reasons. First of all, taking care of a child not only improves them temporarily, but it can also mold their future. Diagnosing and managing chronic medical conditions not only improves their quality of life in the short term, but also in the long term. So we're taking care of the patient's future. Second, for all people of all cultures, of all social backgrounds and religions, the most important thing they have is not money, it's not social status, it's not friends, it's not even other family members, but their kids. The kids is what we hold more valuable. So they put a lot of trust in our profession, and that gives us a sense of great responsibility.
What does a typical workday for you look like when you're taking care of patients?
The days change, but in general, I wake up early in the morning. I go straight to the hospital to see my patients. After that, after I see my patients in the hospital, I go to one of my clinics. At the clinic, I see multiple patients. Sometimes, most of them are well child visits, but I also see a lot of sick patients. Um, I also take care of some administrative work. At around 5 o'clock, I'm done. I go home. I do have all the activities. At around 9 p.m. after dinner, before I go to bed, I go log into the hospital's portal and check how my patients in the hospital are doing. So I get and I get I check the lab work. I get ready for rounds the next day. I also answer all the phone calls from my patients. So if they have any question after hours or they develop any medical conditions and their parents are concerned, they call me and I take care of them.
Could you walk me through the educational pathway that you took to become a pediatrician?
Well, after graduating from medical school, I was raised in Peru. So after graduating from high school, I went directly to medical school. I went to medical school in Peru. It takes 8 years to graduate. After that, I went to do pediatrics, the pediatric specialty in New York at the State University of New York at Brooklyn and Staten Island.
In your experience, what personal qualities and or habits are the most important for success in the pediatric or just medical field?
I think the most important qualities to be a pediatrician are, first of all, empathy. In general, for medicine, you need persistence and the ability to apply medical knowledge into the individual patient.
Okay, thank you. Now I would like to ask some questions that are a little bit more science oriented.
Mhm.
First off, how do different areas of science, such as physiology, developmental biology, or psychology, influence your decision making as a pediatrician?
Well, basically, patients are individuals, right? They're not just a combination of medical problems or biochemical abnormalities, right? The problems cannot be managed only with medical knowledge. A patient might have individual physiologic problems, congenital diseases, metabolic diseases, cardiac malformations. Uh, a patient can have psychological and developmental problems that might complicate the management of the condition, right? For example, if you have a patient with chest pain, shortness of breath, you could think, okay, this is a heart condition. But there are other conditions that can mimic the same symptoms, like anxiety disorder, panic attacks. Uh, Without knowledge of psychology, physiology, you can go to the wrong diagnosis and the wrong diagnostic approach. You might diagnose the patients for a cardiac condition, spend a lot of time and money pursuing the wrong diagnosis when instead of addressing the real problem, which is basically a psychological problem. And that is just an example. This applies to multiple medical conditions.
What scientific tools or technologies do you most rely on when diagnosing or monitoring your patients?
Well, the most important thing to reach a diagnosis and management is medical knowledge and applying that knowledge into the individual patients. But sometimes we need, you know, things that guides us to the diagnosis or to confirm our diagnosis, right? We use multiple tools and technologies in our routine day. In our office, we use medical equipment to check the patient's hemoglobin, lead levels. We check the urine. We can do pulmonary function tests. Uh, we use rapid diagnosis tests to diagnose infections like influenza, RSV. When that is not enough, we can do outsource tests to the labs. We can do blood tests, imaging tests like X-rays, CT scans, MRIs.
How have scientific advancements like new vaccines, advanced imaging technology, or just improved diagnostic tests changed pediatric care in recent years?
Scientific advances have improved the length and the quality of life of patients with chronic diseases like cystic fibrosis, congenital heart disease, seizures, and it keeps on changing day to day. For example, immunizations have helped us to prevent multiple infectious diseases. The most recent clear example was COVID. The COVID vaccine has saved millions of lives. Early diagnosis of metabolic conditions like cystic fibrosis has allowed us to closely treat early and prolong the lifespan and quality of life of multiple patients. The management of cancer in pediatric patients changes day to day. Uh, the advances come very quickly to the point that, for example, leukemia in childhood, which is the most common cancer that we see and we diagnose, is nowadays, for the most part, a curable disease. That was not the case 15, 20, 30 years ago. All these thanks to genetic testing, advances in chemotherapy, radiotherapy, new antibiotics, immunology advances.
How does the scientific method guide your approach when you're diagnosing illnesses or just evaluating symptoms in your patients?
Mhm. We use the scientific method basically with every sick patient we see. Most of the patients in general practice have straightforward, simple diagnosis with straightforward treatments. But some of them, they can be a diagnosis challenge that requires us to get a detailed history, a detailed physical exam. Then we propose a differential diagnosis. The most possible diagnosis might explain the patient's condition. That would be our hypothesis. Then, to prove our hypothesis, we request auxiliary tests like blood tests, X-rays, that confirms or guides us to a new diagnosis. If we do not arrive to the correct diagnosis, that means our hypothesis was wrong and we start all over again.
How does your knowledge of chemistry help you understand how medications work in a body, especially since children metabolize drugs a bit more differently than adults do?
Yep. So knowledge of chemistry and biochemistry are very important how medication works. Knowing the mechanism of action of drugs, including the receptors, the transport, metabolism, and excretion, are basically are very important for us to choose the right drug at the right dose for each individual patient. For example, in pediatrics, we do not use standard doses. We choose the dose of a certain medication based on the patient's age and weight. In certain patients, we also have to consider possible factors that might affect the metabolism of the drug, like the pH of the blood, status of the liver function, albumin levels. Albumin transports a lot of drugs, and the alterations in albumin can affect the availability of these medications. We also have to consider the kidney function. Also, we have to consider interaction with other drugs.
When you're conducting tests such as blood exams, how exactly does your knowledge of chemistry help in interpreting the results?
Well, for the appropriate functioning of our bodies, our blood chemistries must be very stable. The balance of sodium, potassium, chloride, bicarbonate, oxygen, calcium, magnesium, iron are important for homeostasis. Interactions between them, the pH of the blood, function of the liver, function of the kidneys, hydration, and multiple other factors are paramount to the function of our organs to sustain life.
Could you share an example of how understanding chemical interactions or drug mechanisms has helped guide you to a treatment decision?
Sure. Many medications interact with each other. Patients, especially patients with multiple medical conditions or complex problems, require multiple medications. Some of these medications do not interact with each other, but a lot of them do. So it is very important to understand how medications work and their metabolism to predict their interaction and modify our therapeutic approach. For example, phenobarbital is a medication that we sometimes use for patients with seizures. Um, Phenobarbital can increase the metabolism of other drugs. That means that in patients in which we use phenobarbital, we need to use a higher dose of other medications that are metabolized in the liver. Example of medications that are metabolized in the liver are, other anti-epileptic drugs, steroids, antipsychotics, immunosuppressants, some cardiovascular drugs. In those cases, we will need to use a higher dose to counteract the fast metabolic breakdown induced by the phenobarbital.
How important is chemistry knowledge when you are educating parents about like fevers, hydration, nutrition, or medications?
Chemical imbalances can occur with multiple medical conditions and medications. Educating our patients about the appropriate use of medications is important to avoid chemical problems in our patients. For example, the dehydration can cause metabolic acidosis, hypernatremia, hyperkalemia. This can translate in lethargy, decreased urinary output, heart arrhythmias, seizures. For that reason, educating the patients help keeping educating our patients to keep them well hydrated is very important. Nutritional problems like obesity can predispose patients to have high glucose levels and develop diabetes in the future. Over the counter medications, when used inappropriately, can cause complications and can interact with other medications. For example, the persistent use of non steroidal anti inflammatory agents like ibuprofen, which is widely used, can cause hyponatremia, hypokalemia, metabolic acidosis. Antacids that are used commonly, like Mylanta, can cause high magnesium levels that can cause pull muscle tone. Tums, which is a medication, another antacid medication, can cause high calcium levels. Excessive amounts of vitamin D can cause hypercalcemia. So a lot of over-the-counter medications can cause chemical problems in our blood. So that's why it is so important to educate our patients about the cautious use of over-the-counter medications.
Those are all the questions I have for you today. Thank you so much for taking time out of your day to answer these questions. Um,
Thank you
is
very
there
much. Mm.
is there anything else that you would like to add that you think students should know about pursuing a career in medicine?
It's a very long, hard, but very rewarding career. Taking care of, there's no higher call than to take care of other people. So yeah, it's a great career.
Okay. Thank you again for your time.
Thank you very much.
Thank you.